Hey, I'm Dr. Taylor, and in this video, we'll discuss how you can reduce the amount of pain that you experience during childbirth. I want to start by saying that the pain of labor and delivery varies among women, and everyone's labor experience is different. Physicians should always encourage you to be involved in your plan for pain management during labor. So if we've been tolerating pain during childbirth for generations, why try to minimize it now? Here are some of the potential benefits of providing good pain relief during your labor. First, by helping to slow down your breathing, it results in more oxygen delivered to both mom and baby. By helping to lower your stress hormones that constrict blood vessels, it results in increased blood flow to the placenta and to the uterus. There's some evidence to suggest that adequate labor pain relief can actually lower your risk for postpartum depression and chronic postpartum pain. And lastly, but perhaps most importantly, it can make your delivery a more comfortable experience. So, what are your options for pain reduction? We'll start with the pain reduction technique that is most consistently effective. These are epidurals and spinals. You should know, epidurals and spinals do not increase the risk of needing a cesarean or instruments like forceps during your delivery. These procedures are very common in the United States, with more than 70% of women who give birth receiving a spinal and/or epidural. And keep in mind that spinals and epidurals are also done all the time for other types of healthcare procedures like knee replacements, hip replacements, foot surgery, lung surgery, abdominal surgery, you name it. These are super common procedures with a great track record for safety. So, what are epidurals and spinals, and what's the difference between them? In terms of the patient experience, they're very similar. They're procedures done by an anesthesiologist in which we inject numbing medication into your back near the nerves that carry pain signals up to your brain. Here are the specific steps for an epidural. First, we'll make sure you have an IV or drip in your arms so that you can receive fluid and medications. Next, we'll ask you to either sit on the side of your bed or lie down on your side with your knees kind of tucked up to your chest. Then we'll use a very tiny needle to numb the skin on your lower back. We'll place a needle in your numbed skin and advance it slowly just a few centimeters. This should really feel just like pressure at this point. Then we thread a thin, flexible, sterile tube, super tiny, through the needle, and then we take the needle out. So now there's just this thin, flexible tube or catheter sitting a few centimeters under your skin in a location called the epidural space, a little pocket outside of the nerves, again, that carry pain signals up to your brain. The catheter sits there. Seriously, it's like just a little piece of angel hair pasta. It doesn't hurt. And it delivers pain medication continually that bathes the nerves and provides good pain relief. It's common to then have numbness over your stomach and in your legs while the epidural catheter is in use. Once the medication's stopped, the numbness wears off within a few hours. Spinals are similar, except it's just one quick injection of medication and there's no catheter that's left in your skin. The needle also goes in just a tiny bit farther than an epidural catheter. These wear off quickly and are reserved more for quick cesarean deliveries rather than vaginal deliveries where you usually have an epidural. Epidurals and spinals are safe, but like any procedure, they have risks. These include low blood pressure. By reducing your pain, we decrease all the stress hormones coursing through your body that normally pump your blood pressure up. You can get itching, nausea, vomiting. This is because low-level opioids are given in the infusion through the catheter. Another possibility is urinary retention. Because we're numbing your nerves so well, you may not have the urge to pee. The next is postdural puncture headaches. This is more common in pregnant women, unfortunately, than in other people who receive spinals or epidurals. This is a headache that results from the leakage of CSF, or cerebrospinal fluid, when the needle used to place the epidural or spinal causes a hole in the covering of the spinal cord. Because of the changes in fluid balance, you might get a bad headache. It typically resolves on its own in kind of 7 to 10 days, but there are also procedures that can be done to help the headache. Another side effect that can happen is bruising or hematoma. This is very rare, somewhere around 0 to 0.6 per 100,000 epidurals. Very uncommon, and is more likely in patients with bleeding disorders, who probably aren't great candidates for epidurals in the first place anyway. Next, perhaps the placement of the epidural or spinal wasn't perfect. We're not always perfect at placing them. Or you have unusual spinal anatomy. In that case, the epidural or spinal may not work as well as planned. A very very rare side effect is nerve damage. One study of about 123,000 epidural and spinal procedures in the United Kingdom found no reports of spinal cord damage. But that doesn't mean it can't happen. But keep in mind it's more of a risk in difficult epidural or spinal placements due to obesity, high placement of the needle, meaning higher up on your back, pre-existing spinal disease or problems with your vertebrae, and diabetes. But again, this is extremely rare. Okay, so we talked about neuraxial nerve blocks, or the ones that go into your back, spinals and epidurals. Again, these are the ones that provide the best pain relief out of all your options. There are other types of nerve blocks that you may have heard of. Really, the only one that's done these days is the pudendal nerve block that can be added to an epidural for extra coverage if you're a little uncomfortable in one particular area. Or it can help women who don't have an epidural who need a forceps delivery. What about opioids or similar medications? Can't those just be used to help manage pain? Unfortunately, opioids are generally not as effective as the neuraxial techniques of spinals and epidurals. One study showed increased sleepiness with minimal change in pain scores when we use opioids. Importantly, and keep this in mind, opioids cross the placenta. This can slow newborns' breathing and cause them to act differently than they would otherwise. Opioids, as you probably know, are also associated with maternal drowsiness, vomiting, and nausea. One of the most commonly prescribed opioids for labor pain, if you do end up getting an opioid during your delivery, is meperidine. It is less often used in the United States due to some concerns about the impact of the drug's metabolite, one of the drug breakdown products, on the fetus, specifically how it can inhibit breastfeeding and change neonatal behavior. The metabolite that builds up in the baby also cannot be reversed with naloxone, an opioid reversal agent, meaning there's really no way to undo the medication that you gave. Finally, you may have heard about nitrous oxide, or laughing gas. Some hospitals offer this to patients. It consists of a face mask that you hold over your nose and mouth, and then when you inhale, gas comes in. It can be a little tricky because nitrous oxide analgesia, or pain relief, can take up to 50 seconds to reach its peak effect. So you need to time your inhalation to about 30 seconds before the contraction starts. This can be a lot to keep track of, especially when you need to focus on pushing with each contraction. There aren't great studies on the effectiveness of nitrous oxide for labor pain. It shouldn't be used if you have underlying lung disease or low oxygen levels in your blood at baseline. Nausea and vomiting are also well-documented side effects. It's also a drug associated with very high level of environmental pollution. Now, after all of this, if you have any questions, please leave them in the comments below. Also, I'd be grateful if you'd like this video and subscribe to my channel. See you next time.